Hello everyone. Today's video is about treating mold hypersensitivity. Just before jumping into the video, if you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So somebody posted a question on one of my other videos saying, I was wondering what are the treatment options used for mold hypersensitivity, where the given mold levels are innocuous to the average person but elicit an extreme reaction for the individual. So thank you for the question. Also, kudos on using the word innocuous. We just don't really use that word enough in our society, I think, at least not in my experience. So it's just such a great word. So with mold hypersensitivity, I guess, it would be handy to have like a little more context so I can answer your question as usefully as possible, but I'll just give kind of a broad answer and hopefully I'll cover it. So, when we say mold hypersensitivity, a person might just be referring to mold allergy, and not to downplay that, mold allergies can be quite problematic, very non-innocuous for some people, but then there could also be more of like a systemic or more of a systemic mold hypersensitivity where, say, there's mold toxins in the body or mold itself that's colonized the sinuses, and then that's leading to a more diffuse hypersensitivity syndrome where a person's having diffuse pain and or brain fog and or fatigue and or all the symptoms we'd typically associate with, say, mold toxicity. So where a mold allergy might be, quote unquote, just, stuffy nose and watery eyes and that type of thing. So if it's mold hypersensitivity from just, quote unquote, just an allergy perspective, in my experience, over and above, working with mast cell stabilizers like quercetin, or using antihistamines like cetirizine and diphenhydramine and whatnot, low-dose allergen therapy, or LDA therapy for short, is my go-to for treating allergies of virtually all kinds. I've posted other videos about LDA therapy before, so please go to my YouTube channel, keyword search LDA or low-dose allergen therapy, and videos should pop up on that. So just for a regular old mold allergy, that would be my go-to. Other allergy desensitization treatments like sublingual immunotherapy, known as slit therapy, or possibly having just more traditional allergy shots done could also be options, but the LDA therapy seems to be the most consistently effective, very cost-effective, non-invasive, wonderful therapy. Now, if it's more of a systemic mold hypersensitivity, then I would still, for my patients, still be thinking of low-dose immunotherapy because it's just wonderful for helping to reduce hypersensitivity reactions of all ilks in many cases. But in those cases, in that type of case, I would also be thinking of using other things like more systemic immunomodulators like NAC and quercetin again, but not just for the mast cell stabilizing properties, but also for the immunomodulating properties in general. Be thinking about possibly using intravenous ozone therapy, which is a very strong immunomodulator in many cases, and possibly some other immune system balancing supports, possibly some medicinal mushrooms like reishi mushroom, or possibly some immunomodulating herbs like, say, cordyceps mushroom, or possibly using some, oh my gosh, tip of my tongue here, red root ceanothus, I think is the other name for that one. So the different Japanese knotweed would be another one. Chinese skullcap would be another one. So getting into more like immunomodulating tinctures and things like that. So those would be some of the agents that I would use. Really, the LDI for mold, or LDA for mold, kind of tomato, that would be the main driving force in that type of protocol. The one thing that I would also consider bringing in, and it's a little bit of a segue, but still kind of on topic, is bringing in some molecular hydrogen. I've been having more and more feedback from patients telling me that molecular hydrogen has been really helpful for them. I'm hoping to have a podcast episode interviewing someone talking about molecular hydrogen. So if you're watching this video and you know someone who might be willing to be on my Overcoming Chronic Illness podcast, and they know a lot about molecular hydrogen, please feel free to post that in the comments section. I have a couple of folks that I'm considering approach or thinking of approaching, but just hasn't got to the top of the to-do list yet. And I'll also just post a video of myself talking about molecular hydrogen, just a little, just a non-podcast interview video about that. But molecular hydrogen is something that I've been seeing more and more benefit from. It's been on my radar for many years, but some of the products that I tried in the past, I found they didn't really work all that well. Over time, I learned about these little drops that you can get, these little test drops, so you can test the hydrogen concentration in the hydrogen water that's produced either by using hydrogen tablets or using like a hydrogen water generator. And so we've been testing a few different products. I'm eventually planning to put together a longer video where I kind of go over the various products that I've tested and what came up. But what's been very eye-opening and a little bit what's the word I'm looking for? Well, I'll say unexpected, is that some of the products have not tested nearly as well as what the bottle says they're supposed to have in them. So looking back with hindsight, it's like, oh, maybe I wasn't really seeing a lot of consistent results with some of the previous molecular hydrogen products because they just weren't actually making as much hydrogen as they were supposed to be making. But we've been using this product here at our clinic. I have no financial affiliation with the product or the company at all, but it's a product called H2 Absorb. It's by this company called Research Nutritionals, based out of the US. And that's been testing, or that the hydrogen concentration tests really well, and that's what I've been using in practice for the last while, and it's been really helping a lot of patients. Patients reporting less pain, less brain fog, sometimes better energy levels, sometimes better physical endurance, and so I'm not quite at the point where I'm ready to start prescribing it to everybody en masse because I am prescribing it in specifically selected cases, but anyways, it's something that I've been very encouraged by, and it's rapidly becoming moving higher and higher up my algorithm of things that I'm recommending for folks. So I've been quite encouraged by that. So I feel like if I had a patient that came into my office today and said, it seemed that they had mold hypersensitivity, I'd be recommending the things that I've already mentioned, but then I'd also really be thinking about molecular hydrogen because it just seems to be good at kind of mopping up these free radicals that are running around in the body and just helps people feel better faster. As a naturopathic doctor, or anyone who's practicing in the functional medicine realm, we're always striving to treat the root cause of illness, which is so important. You want to treat the problem so it solves the problem. But symptom relief is really, really valuable too. When you have fewer symptoms, then you feel better. But then when you feel better, you can also heal faster. When you feel better, you can do the diet stuff, do the exercise stuff, stay on top of your supplements, do the mind-body stuff, whatever it is that you need to be doing. But then also your body's not wasting energy, wasting resources, dealing with the pain and fatigue and all these things as much. So you actually have more cellular energy resources to work on the root cause stuff. So I'm a big proponent of symptom mitigation, as best we can, as quickly as we can. Obviously, without throwing out the baby with the bathwater, you don't want to be, a person doesn't want to say just be, oh, I'm going to go on prednisone or something like that. It's like, oh, my pain's all gone, but then, they're becoming diabetic and having all these, other side effects coming up. Nothing against prednisone; it's a wonderful drug, but there can be quite a price to pay for that. So we want to reduce symptoms, but also be responsible with trying to cost benefit ratio with what are we using to reduce those symptoms. So, anyways. Molecular hydrogen, been very excited about it. I'll be posting more about it in coming videos. I hope this information was of interest. If anybody has any comments or questions on this topic or anything else, just post in the comment section below, and I will do my best to answer as soon as I can.